A wounded SEAL was bleeding out on a trauma table in the middle of the worst night the center had seen in months. The nurse in bright blue scrubs stepped forward with her kit, and he shoved her arm away. "Call someone experienced, not a nurse." The doctors watched. Nobody moved. Then she rolled up her sleeve. And the SEAL saw the tattoo. The insignia of a unit so classified that most generals don't even know it exists. He had seen that mark once before, on the shoulder of a mission commander during an op he was never allowed to talk about. His face went pale. His voice went quiet. And the room changed. If you've ever been dismissed by someone who had no idea who they were talking to, this story is for you. Hit that like button before this one ends. Drop a comment and tell me where you're listening from right now. I read every single one. And if you're new here, welcome to Secrets of Silent Badges. Subscribe and come join us. We're just getting started. The blood hit the floor before anyone moved. Claire Merritt had been watching it happen for 30 seconds. 30 seconds of hands moving too slowly, voices calling the wrong numbers, a resident standing at the trauma bay door like he had forgotten how doors worked. She did not move yet. She had learned a long time ago that moving too fast in the wrong direction was worse than not moving at all. Dr. Raymond Holt came through the double doors at 11:47 p.m. with coffee in one hand and a phone in the other. He was 44 years old and looked 60. His eyes had the fixed, flat quality of a man who had stopped being surprised by anything, including himself. "What do we have?" he said, not a question. "Multi-vehicle on Route 1, the charge nurse called back. 2 incoming, 1 critical." Holt looked at his phone. He did not look up. Claire was already at the supply cart, running a quiet inventory. She did it without thinking. Needle decompression kit, combat gauze, chest seals. Her hands moved by instinct, the way hands do when they have done a thing 10,000 times in conditions far worse than this. She did not count out loud. She never counted out loud. "Merritt," Holt's voice cut across the bay. "I need you on intake documentation." "Not playing with the supply cart." She turned. She kept her face neutral. "I'm checking supplies, Dr. Holt. We're low on 14-gauge angiocaths. We have residents for that. The residents are—" She stopped. She looked toward the door where the 2 residents were still standing, one of them on his phone. She said nothing else. Holt followed her gaze. He made a sound that was not quite a laugh. "Get back to your station." Claire walked back to her station. Back at her station. Intake form pulled up on the screen. Hands flat on the desk, kept very still, the way she had been taught to keep them still during long surveillance windows in places where movement meant death. The fluorescent light above her flickered twice. Outside, rain had started against the windows. Hartwell Memorial Trauma Center was not a bad hospital. It was understaffed and underfunded, and running on equipment that was 3 procurement cycles out of date. But the people in it mostly tried. That counted for something. Claire had worked in places where the people did not try at all, and the difference was significant. She had been at Hartwell for 11 months. Before Hartwell, she had been nowhere that existed on any official record. Her ID badge said, Merritt, CRN. It had her photo, her employee number, her department. It said nothing else. The badge was accurate, as far as it went. Holt appeared at the edge of her station. He set his coffee cup down on her desk without asking. He looked at her screen. "Your charting is behind." "By 12 minutes, she said. "The system was down earlier." "I don't care about the system, I care about the chart." She looked at him, not with anger. With the specific, calibrated patience of someone who had sat across a table from people who were trying very hard to make her break and had walked away from all of them. "I'll have it updated before the incoming," she said. He stared at her for a moment. Something in her stillness seemed to bother him in a way he could not name. He picked up his coffee and left. Claire let out a breath she had not been holding. That was a habit. Breath control was a habit. Everything was a habit when you had trained long enough. She updated the chart. The rain got louder. Across the bay, the charge nurse, a stocky woman named Val with 20 years on the floor, caught Claire's eye and offered a small shake of her head. The kind of shake that meant something like, "Don't let him get to you." Claire nodded once in return. Val had been one of the first people at Hartwell to actually look at Claire. Not through her, at her. It had taken Claire 3 months to let herself be seen, even that much. Old habits. The trauma center at this hour had its own specific sound. The low hum of equipment, monitors cycling, the intermittent squeak of rubber soles on linoleum, the abbreviated conversations of people who had been awake too long and had learned to communicate in half sentences and looks. Claire had worked in buildings with far greater ambient noise and far more threat per square foot. She had worked in buildings without walls, without power, without anything resembling a supply chain. She had worked in total silence, which was the worst kind. Because total silence in the wrong context meant something had changed, and you had not yet identified what. The trauma center was not silent. The trauma center was manageable. She kept that framing. Manageable. The word she used for spaces she had chosen to inhabit, rather than spaces she had been assigned. At 11:52 p.m., the radio on the wall crackled. "Hartwell Trauma. This is Medevac 7. We have 2 inbound. ETA 4 minutes. First patient, adult male, blast concussion, lacerations, stable. Second patient, adult male, gunshot wound, femoral region, hemorrhage control in progress, pressure critical. Advise you prepare for surgical." The room snapped into a different register. Holt was already moving. He was good in the moments when the machine ran. Whatever was hollow in him day to day, something switched on when the urgency came. She had seen it before in men who were only truly alive in the edge moments. She knew that feeling better than she would ever say. "Bay 2 and Bay 3, Holt called. "Surgical prep on Bay 3. I want type and cross, 2 large-bore IVs, O-neg running before they hit the door." Claire was already moving, not toward intake documentation, toward Bay 3. Quiet, efficient, no announcement, no wasted motion. The IV setup was ready before the surgical resident finished gloving. O-neg line running, pressure checked, taped off. Holt did not tell her to move. He also did not say thank you, neither registered. The helicopter hit the pad at 11:56 p.m. Claire stood at the edge of Bay 3. She had her hands clasped in front of her at waist height. Her auburn hair was up in a loose bun, a few strands loose around her face. Her bright blue scrubs were worn and clean. She looked like exactly what her badge said she was. The doors opened. The first patient came through on a gurney moving fast. Male, mid-30s, athletic build, close-cropped hair, wearing the remnants of tactical gear that had been partially cut away. Standard lacerations, contusion on the left orbital. He was conscious, and he was not happy about it. The second patient was worse. He came through pale and not entirely present. The wound was high on the inner thigh, combat tourniquet applied above it, tightened hard. Whoever had applied that tourniquet had done it correctly. The junctional area was the issue. The compression above was holding the main bleed, but the inguinal fold was showing pressure suggesting collateral damage. Claire looked at the wound for exactly 3 seconds. She had seen this wound before. Not in a trauma center. In a river valley. In the dark. With no equipment and 2 hours until any medevac was coming. She reached for her gloves. The first patient, the conscious one, sat up on his gurney and grabbed her wrist. He was not rough about it, but he was firm. "Not you," he said. His voice was flat and certain, the voice of a man accustomed to giving direction that got followed. "Get me a surgeon, a real one. No offense, sweetheart, but my guy needs more than a nurse." The room went very quiet. Claire looked at his hand on her wrist. Then she looked at his face. He was watching her with the direct, assessing look of an operator. She knew that look. Claire had worn it for 15 years. She kept her voice completely level. "Sir, I need you to release my wrist." He released it, but he did not back down. "Where's the attending?" "Right here." Holt appeared behind her. He assessed the room with the rapid clinical scan that was genuinely one of his best qualities. "Step back, Merritt. I'll take primary." She stepped back. Claire stood at the edge of the bay with her hands clasped, watched Holt assess the wound, watched him call for the wrong gauge, and she started counting down from 10. The countdown reached 3 before Holt made the call she already knew was wrong. "Pack it," he said. "Standard gauze, pressure hold." Claire's hands tightened against each other at her waist. Standard gauze on a femoral junctional bleed with collateral involvement was not wrong in the way that would kill a patient immediately. It was wrong in the way that would allow the situation to quietly deteriorate over the next 6 to 8 minutes, until suddenly the options narrowed to one. She had seen that specific calculation resolve badly before. Men had died while it resolved, in the dark, with her hands on them. Breathe in, breathe out. The conscious patient. The operator who had grabbed her wrist was watching Holt work. His name tape had been cut away with his gear, but Claire had already catalogued his physical indicators, the conditioning, the specific distribution of muscle mass, the way he held himself even while injured, spine straight, weight balanced, ready. The faded scar along the left jaw that had the particular geometry of a fragmentation wound. She knew what unit he was from. She had not said so. "Heart rate is climbing," the resident called. 110, 115. "He's agitated from the flight," Holt said without looking up. "Increase the drip." The resident hesitated. Claire could see the hesitation from where she stood. The resident was young and not yet broken of the habit of noticing when something was wrong. "Good. Keep that habit." "BP is dropping," the resident said, carefully, like he was testing whether it was allowed to be true. 88/60. Holt's jaw tightened. He looked at the wound again. Claire saw the moment he realized the standard pack was not controlling it. She saw it in the way his body changed, the subtle contraction of the shoulders that meant recalibration. She saw the half-second of something that looked like uncertainty before the armor came back up. Holt was not a bad surgeon. He was an exhausted one. In trauma, the difference between those two things could be very small. Val appeared at Claire's shoulder. The charge nurse moved the way experienced nurses move, without announcement, without fanfare, appearing exactly where she was needed. "Holt's losing it," Val said under her breath. "He knows the protocol," Claire said, equally quiet. "Then why is he running standard pack on a junctional?" Claire did not answer that. The monitor alarm began. A flat, consistent tone that was not the catastrophic sound, but was the sound that preceded it if nothing changed. Holt looked up. "Get me a vascular consult now." "Vascular is 20 minutes out," someone called back. "Dr. Reyes is in OR2. The mathematics of the situation resolved themselves in Claire's head in approximately 4 seconds. 20 minutes for vascular. 6 to 8 minutes of controlled deterioration before the bleed exceeded what pressure alone could hold. A BP already at 88 and falling. A patient with the physiological reserve of a trained operator, which was significant, but not infinite. There was one intervention that could bridge the gap. It was not a standard nursing procedure. It was something she had learned in a basement facility at Fort Bragg in a training rotation that did not appear in any official curriculum. Taught by a physician's assistant who had deployed to 6 countries and whose name she was not authorized to repeat. She had performed it 4 times in field conditions, once on herself. The monitor climbed to 120. "Pressure is failing," the resident said. Holt looked at his hands, just for a second. The look of a man doing rapid and uncomfortable math about what he could and could not manage in the next 3 minutes. Claire unclenched her hands. She walked to the cart. She pulled the specific items she needed, with no hesitation and no extra motion. Combat gauze impregnated with kaolin hemostatic agent. 2 units, 10-inch by 4-inch. A sterile field pack. Gloves, size 7. Not 6.5, which was what the cart usually stocked for nursing staff. She had restocked those herself 3 weeks ago. Nobody had asked why. Holt's voice came from behind her. "Merritt." I said, "Step back." She was already gloved. She turned. She looked at him directly, not with challenge, not with hostility, with the specific quality of presence that had once caused a general to stop mid-sentence in a briefing room and say, without knowing why, "Who is that?" "Dr. Holt," she said. "The junctional fold is involved. Standard compression will not hold the collateral. You need direct pelvic counterpressure with hemostatic packing, held manually, minimum 90 seconds. I can do that while you manage the primary." Silence. Holt stared at her. "Where did you learn that?" "It's in the TCCC protocol update from 2019, she said. Section 4, junctional and inguinal hemorrhage. This was true. It was in that document. It was not typically known by floor nurses at level 1 trauma centers in the Virginia suburbs. The monitor hit 130. Holt looked at his patient. He looked at the monitor. He looked back at Claire. "Do it," he said. She was already moving. The packing went in with the precision of someone who had done this in the rain, in the dark, at altitude, on a moving vehicle, and once in a room that was actively on fire. The pressure she applied was exact. The angle of counter-pressure against the pelvic structure was exact. Her hands did not shake. They never shook in the field. The monitor began to fall. 128, 122, 115. "Hold that," Holt said, and something in his voice had changed. Something he was not ready to name yet. "I have it," Claire said. The conscious patient, the operator on the gurney behind her, had been watching everything. She felt his eyes on the back of her neck. She kept her focus on the wound. 110. 105. "BP stabilizing," the resident said, unable to keep the relief out of his voice entirely. "Pressure holding," Claire confirmed. "Collateral is sealing." The room breathed. Holt worked the primary. His hands were good when they were working, genuinely skilled beneath the exhaustion. Fast and clean. No wasted motion. They worked in a silence that was not uncomfortable. 2 minutes in, the patient's color had improved. At 3 minutes, his vital signs had crossed back into survivable territory.